A warm welcome to all our viewers to our series Natural Medicine. Recently, well, not just recently, a few already, I had the honour that professors from the University of Vienna were with me and told me about their very impressive research regarding cold red light. And then I asked a little bit around in Switzerland too. Various doctors are already working with it in the area of wound regeneration, so faster wound healing, in the area of pain treatment, and in many things more. And today I found another doctor who is very successful in dealing with this cold red light, and I'd like him to tell us more in detail what he can say about it, the medical use of cold red light. For us personally, nowadays. It's my pleasure to welcome Dr. Walter Wührer. A warm welcome, hello, dear Mr. Wührer. Hello, welcome, thank you for the invitation. My pleasure. You've had your practice in Salzburg. Yeah. So I'd just like to ask, in what context do you work with cold red light, and with what amazing successes? That would interest me. Basically, pain in the musculoskeletal system is a topic in general medicine that is very common. In a holistic concept, one tries to straighten the spine to restore the imbalances, but there are also symptoms of inflammation, which of course are very protracted. You might have to work with cortisone or other medication to be successful quickly. And here, the cold red light is actually a game changer. Here you can heal inflammation very quickly, locally, but also via other trigger points and lymph-moving therapies. So, I can say in practice the success is almost regular if you use it correctly. And in a holistic concept, it is very quick, then also persistent and in the long term. It is a medically approved device. Is it a device that only you doctors can use for the patient? Or is that something that the patients can use themselves at home? The patients can use this themselves at home, but of course they need a briefing to operate the device properly. As with all laser products, there is also a safety training course so that you don't shine it unprotected into the eyes. Keep it away from children. It's not a toy. But of course, when these simple safety precautions are followed, it's also very convenient to use at home. It can be rented, and here you have, of course, a much faster success rate. But it's also important to guide patients in how to use equipment. I keep finding that certain subtleties do make a difference, and if, for example, you forget to open the lymph, then it is difficult for them to break down these inflammatory substances. And it comes to an initial deterioration that the patient may misinterpret and then stop, even though they're exactly on the right track. Okay, well, so it's very important that a doctor is interposed to instruct this. Our viewers don't even know all of this, and their own doctor may not know it either. How do they then come to this opportunity to discuss this with their own doctor? When they say, I don't want any medication, I don't want cortisone, I'd like to take a different route. Now, they see our broadcast, and now what happens? There's a homepage that offers information. There are also indications mentioned here, and here you can quickly find whether the disease in question is treatable or how successfully it is treated with the Repulse. There are YouTube videos with sample applications, but you can see very quickly that it actually can be used for almost any indication, even at least indirectly, for example, to move the lymph, treat trigger points, even energetic applications are possible, if you are open-minded here. See, you can actually always build it in well. To treat pain, inflammatory pain, there's almost nothing better in my experience, or anything that leads to success so regularly. That means that the viewer could get information directly. Or do they have to inform the doctor that they need to find out more? Yeah, as I said, there are companies like Relux.at, the company homepage. There's also a telephone hotline, a consultation. There is always someone who is competent to assist you, even if there is no experience. They advise on the training and allow first contact with this device so that it works well. I've read that nowadays the Austrian health insurance companies are even able or willing to pay for such therapeutic approaches with this cold red light. So even the purchase of such devices is supported. The rent is supported. And I found that very interesting because we've never actually heard of it in Switzerland. Basically, it always differs from state to state. It would make sense, of course, because the patient would save on therapies with disproportionately higher side effects, and an appropriate control doctor with a correspondingly approved opinion of a doctor, of course, could be inclined to approve that, and that would also be positive. You are really very far advanced with that. For once, it's you in Austria, otherwise it's always us Swiss. In the field of complementary medicine, of course, I am particularly pleased. But now again to this cold red light, because what I don't understand, and maybe I hope that you might be able to give me some ideas, why cold red light? Why can it be so effective on an inflamed area on the body that causes pain? From the energetics alone, it is obvious that heat is not necessarily treated with heat, so it actually makes a plausible sense that just as you put on an ice pack, you don't treat with heat because in heat processes, heat may be perceived as unpleasant under certain circumstances. But besides the cold red light aspect, it's just the frequency, or the frequency range that is suitable to split and inactivate inflammatory substances, which are then transported away accordingly. And this frequency range is safe and effective. I think that was simply the challenge in development, to find a frequency range that is safe and effective. Because, of course, irradiation therapy, over and over again, in the long run, it has aspects, whether it can be mutagenic somehow or could have other side effects. But in this case, an effective and safe device has evidently been made. We've had long experience and good experience with this. We're not talking about infrared here, we're really talking about cold red light. We're not talking about the red laser either, but are we only talking about red light? It is a pulsed LED laser with a certain frequency range, which can penetrate the tissue very effectively and split inflammatory substances, and also produces a kind of suction effect. Laser light or LED light is scattered, doesn't go that deep, but through a kind of suction effect, lymphatic stimulation, it comes to a deep activation via the surface and to a removal of inflammatory processes. How long have you been working with this technology yourself? I think it's been 10 years, 8 to 10 years that I've been working with it. Also, personally, I always have a device at home because it is actually part of the medicine cabinet. I can remember trying my son's hoverboard for Christmas and getting a tailbone contusion, which normally hurts for a very long time. That was just gone in 2 or 3 days. So I have intensely irradiated myself, and it impresses me again and again how well it works when you just apply it consistently. I mean, I've never heard of this logic that an inflamed area that gives off warmth is treated with cold red light, but it's completely logical, so that even I understand it now. Thank you very much. How else do you use it in your practice? Which of your patients are being treated therapeutically with this technology? Basically, any kind of pain in the musculoskeletal system, especially areas that are inflamed. I'm talking about shoulder pain, shoulder calcifications, but I also speak of the possibility to treat myalgias, so muscle hardening, in the system of tension. So you can think holistically and medically here, and should not only go to the locus dolendi, to the point of pain, but also think about where I can regulate in the big picture. With all leg complaints, of course, this would also be a hip point. It can be a neck point for all arm complaints, by improving regulation here, for example. But you can also treat skin diseases in the same way. I've had a very good result with chronic eczema. I remember a patient with extreme skin eczema. Of course, I treat it through the intestines, through detoxification therapies, but of course it takes a long time until such a burdensome eczema can be cured from the inside. And at the same time, you irradiate the eczema from the outside. There is then a corresponding spacer, which may be very interesting to see. So one does not treat one place here, as for example with tooth foci. It would be possible to treat it concomitantly with a spacer. You have exactly the same distance, for example, to treat acne. Here I would have the possibility of treating acne very quickly and locally, and at the same time, of course, from the inside. But adolescents in puberty in particular suffer greatly from skin blemishes, from acne, and sometimes have really severe inflammation with scarring, and are inclined to take antibiotics or retinal preparations with corresponding side effects. And here you can assure them or promise them to see success quickly. And with therapy from within, through nutritional advice, improving the intestinal lining, they'll also see long-term success. What I have already mentioned, dental treatment, is also possible. Just yesterday I had a breast cancer patient with very strong dental foci due to side effects of medication. With local therapy, with the Repulse, could improve the healing very much. So that together with a surgical rehabilitation and with a Repulse therapy, the healing success was significantly faster than you're used to in such a situation. Are there any side effects that you should expect when treating yourself with such a red light? Can you get burned? Oh, no, I can't. It's cold, isn't it? So I think burning is not possible. You must not shine it directly into the eye. You have protective goggles to rule out any side effects here, which you should put on before operating the device. A side effect, in quotation marks, is the initial deterioration, but this is simply due to the fact that you go too much only to the pain point and don't pay attention to the drainage of the lymph. If I may briefly show that again, for example, in the case of a tooth focus, it would be important to open the lymph here below the clavicle, here in the neck area, then here also in the angle of the jaw, and then, for example, go to the tooth focus. If you just go on the tooth and don't drain the lymph here, it can, of course, lead to a strong initial deterioration, which may not be so pleasant. But these are things that are trained because it is a medical device. Everyone should get this information. That is part of the training, and an initial deterioration is, as is often the case in regulatory medicine, a sign that you are on the right track. You just have to be able to deal with it properly and shouldn't overdo it. Also, give the body time to break down toxins here and to break down inflammatory substances. Now, I know a foot surgeon in Switzerland, in Zurich, who is also working with it, and there's a cantonal hospital in St. Gallen. I know that it also works with such devices from the same manufacturer. What I ask myself, however, is how does this knowledge of such a new technology get in the consciousness of doctors and therapists who actually don't even know that there is such a thing? How does it spread? It's very much about word of mouth, both word of mouth between doctors, but also through word of mouth between patients. I, too, often encounter new healing options. When patients tell me that something has helped very well, I pay attention, I research. But you also exchange ideas with colleagues, and I always say that there are a few things that you would buy again quickly if we were robbed. And Repulse is definitely one of those devices that would be at the top of the list of things that have simply proven themselves that I would buy again without hesitation. Because pain therapy, or the possibility of good pain therapy without side effects, is simply important in practice. Of course, I know that we have a lot of viewers who are doctors themselves, including many naturopaths and therapists who are watching today. So the question is it also possible that you somehow, a colleague calls a colleague and talks to them about it? So via the phone, four ears principle, is that something that you say, well, if I have to, I'll do that if someone calls? I am ready to give them some information here. Of course. I think there are really very rewarding concepts in regulatory medicine. It is important that the knowledge spreads and that there is an exchange of knowledge. So I'm always happy when therapies that work are spreading. And I like to contribute here. That's nice. Thank you very much. Good, and patients in your region know where you are and where to go. And everyone else just has to ask their doctor and ask about this technology and hope that the doctor will then get informed further and really contributes to the fact that the knowledge spreads. As always, there are therapist directories. Here you can also see where the next physiotherapist is, or a doctor or an orthopedic surgeon who offers this. This is also an option to look here, whether there is a competence centre in the vicinity where you can ask about it, for example. I didn't even know that. Where can you find this directory? Do you know that too? That's also on this homepage of the company Repulse, www.relux.at. They have YouTube videos, and here you have the opportunity to see different pain pictures during the treatment, and then you can assess for yourself whether that is something, whether it can be a possibility of treatment. A picture is worth 1,000 words. If you look at treatment examples like this, you very quickly get a feel for what this is about and how it works. Maybe one more final question. Are there any other providers who are establishing themselves on the market today with cold red light? Or is this the only manufacturer that has brought a medically approved product onto the market? There are various light therapy devices, all of which have different focuses and effects. But actually, in this frequency range, I personally only know the Repulse device that offers that. Yeah, there are insane regulations nowadays before a device gets medical approval, I know that. And a lot of studies have to be done so that it is really safe for the consumer. Exactly. I think I was allowed to learn a lot, to experience a lot, and certainly our viewers too. And I'm happy to learn alternative routes that are not just treatment with the club, with cortisone and painkillers that is focused only on the effect, but that there is a therapy option here that addresses the cause and works where the problem is to allow faster regeneration. I also had such a device once. I shone through my hands like that, and here it came out again. It's still pretty impressive how much power such a red light has. Or in here, by the cheek, there it came back out again. Yeah, light is also in a certain way biophotons. They are energy carriers. Illness is always combined with a lack of energy, so the pure promotion of energy and of flow of energy is basically a possibility in regulation therapy. That always works. I'd like to thank you very much again for taking the time to give us some valuable information. I think it's great when doctors like you are just such pioneers and just test something and take on something new and use it and then simply share this experience with colleagues, and I will hopefully have a lot of viewers today. Thank you very much. You're welcome. All the best for the future. Stay healthy and keep it up. Thank you. Goodbye. Thank you very much. Goodbye. And you too, dear viewers. I hope the principle of pure cold red light also impressed you a lot. That there are alternatives to these painkillers, to cortisone and so on. And if you have previously been treated with medication, please don't stop. Please do see your doctor. Talk to your doctor about it. Ask about this red light, whether they can deal with it, whether they recommend it to you, or find the way through competent consultants who are available in this regard that would simply accompany you on your way to recovery and healing. With this in mind, thank you very much and all the best. See you next time.